I'm a doctor, and here's a list of a few potentially unexpected things that I never do when it comes to my health. Number one is take antibiotics, like just in case or as a precaution. Antibiotics are great, they are miracles in severe bacterial infections where they can be life-saving. I have seen it almost every day working in the hospital. However, when used inappropriately, they lead to a whole host of problems. We know that overprescribing of antibiotics, especially in the outpatient setting, has contributed to antibiotic resistance. We know that antibiotics are a very common cause of medication side effects, of allergies. They can cause inflammation and damage to the liver and kidneys. We also know that antibiotic use is the number one risk factor for developing C. diff or C. difficile infections, which can be absolutely terrible if you have seen or heard or read about these. But even if you don't get C. diff, the alteration to your gut microbiome can be significant. In fact, there are a couple recent studies that have showed that antibiotic use has been associated with a modest increased risk of colon cancer. And it is postulated that one of the possible causative explanations for this could be the alteration in gut microbiome that comes along with antibiotic use. Again, great drug for the right purpose, but I wouldn't use it just because. Number two, I would never take Benadryl chronically. Another great example of a fantastic medication used in the acute setting for an allergic reaction, a rash, can be fantastic, but it is not meant to be used in the long term. There actually have been some studies that have found a link between long-term Benadryl or other anticholinergic use and the risk for dementia. Plus, the long list of side effects, especially in older adults, can be quite burdensome. Sedation, constipation, blurry vision, confusion, increased risk of falls. It's just not great as a long-term option. And lastly, number three, this is gonna come as a surprise to nobody. I would never trade sleep for productivity. Sleep is not a luxury item. It is not something that I think we should be doing when we have time. It is the cornerstone of health. And there are so many different studies that link chronic sleep deprivation for an increased risk of a multitude of chronic diseases, everything from dementia to cardiovascular disease. In fact, there are studies that show that getting chronically insufficient sleep, typically less than 6 hours, is linked with an increased risk for early death. So yes, every now and again, I will go out and have fun with friends and know that I'm gonna be tired the next day, but on a long-term chronic basis, I do not mess with my sleep. And I typically prioritize it above pretty much everything else. I won't cut my sleep short to exercise. I won't cut my sleep short to watch Netflix, duh. You get what I'm saying. Sleep is just like my non-negotiable. I think that's where I'm gonna leave it today. Let me know if you want more, but follow along if you want a part two.